Dr. Thomas Herrick, he's a urologist on staff at North Kansas City Hospital. Dr. Herrick has some guidelines for prostate cancer screenings that have recently changed. And first off, doctor, let's start with how does someone get screened for the disease?
So we recommend screening by doing two tests. One of them is a blood test, a PSA, and the other is a physical exam, a digital rectal examination.
Okay. What is I've also heard a PSA test. What is that?
So PSA stands for prostate-specific antigen, and this is an enzyme that's produced by both normal prostate cells and prostate cancer cells. PSA is thus prostate-specific, it's not cancer-specific.
Okay.
But in prostate cancer cells, the membrane of the cell is leaky, and that PSA enzyme leaks into the circulation, and then we can measure that by doing the blood test.
That is fascinating. When should somebody be screened?
The American Urological Association recommends screening for prostate cancer in men from age 55 until about age 70. We have some high-risk category groups that need to be screened earlier, from age 40 to age 55, and those are men who have a family history of prostate cancer, which would be a father or a brother or an African-American male.
And here at Fox 4, we have a few who create awareness about that. Our John Holt and Al Wallace are both out there encouraging men of my age to get such tests. Hey, what about treatment? What if somebody is diagnosed with prostate cancer? What can they expect?
Well, the way that we diagnose prostate cancer is by doing a prostate ultrasound and a biopsy. We usually can do that in our office. We don't have to do it under sedation. And then based on that result, we then categorize the patient into different categories: very low risk, intermediate risk, or high risk cancer. 80% of men are diagnosed with either very low risk or low risk prostate cancer, and we don't necessarily need to treat those patients. A lot of times we do what's called active surveillance, where we follow their cancer, but we don't need to treat their cancer. The intermediate risk and the high risk cancer patients, on the other hand, really need to have some kind of treatment.
And that's one thing that I need to do, and I'm so glad that you're here to remind me about what I need to do here, because it's very important for men's health.